now that there's almost a very good quorum, I think we should energize ourselves. So I'll just start with the audio visual which depicts my workplace. Thank you very much. Coming to smart tools in MRI, so all of us have a concept when we say MRI scan, and there are always so many new techniques that keep on happening. So I thought it was a good idea to share with you these new techniques. So when a patient presents with a symptom to a clinician and comes to a radiologist, it is up to a radiologist to see what best he can do, how much detail he can go in and apply all possible techniques available to him so that he can come to a diagnosis. Now this is a technique which we have not spoken very often, that is a dynamic contrast enhancement. All of us are aware that we give MRI contrast whenever we get a focal lesion. So what is this dynamic contrast enhancement? So dynamic contrast is a procedure where we inject the contrast and acquire the MRI images at the same time. So when we inject the contrast, we acquire multiple phases of the contrast in a very short time. So we acquire almost like 16 phases of the contrast in around 3 minutes. And when we get these images, they help us in morphological evaluation. Like we can see in the images how the lesion is enhancing, and we can evaluate the lesion with what we call peak enhancement curves. So we had a neurologist and neurosurgeon speaking in the beginning. It was so wonderful to see two brothers share the platform at the same time. So let us start with a neuro case. So this is a T2 coronal image which is showing the pituitary gland, the master of the endocrine orchestra, and that is how small it is. And this is how it looks in the sagittal image. So when a patient presents with a symptom that relates to the pituitary gland, we do a dynamic contrast. And this is an example of how we see it on the screen when we do a dynamic contrast. So the blue circle showed the normal pituitary in the plain face. And when we inject the contrast, now you can see that it is becoming more and more bright because of the contrast. Now if you see carefully, it is showing a very pinpoint lesion. Let me show you a static image. So it's showing a very small pinpoint lesion here. Let's zoom it up. And that's how small a pituitary microadenoma looks, almost like a pinpoint. So let us see these peak enhancement curves. This is a video which shows what we exactly do. There is a lesion in the left adnexa. So we place our ROI, that is the region of interest, and we get different graphs. Now this is a graph which is of a benign lesion. So you can see that it is ascending up and it is getting into a plateau-like fashion. So when the end of the graph is more horizontal or very gradual, then that suggests a benign lesion. As against that, a malignant lesion has a steep climb, as is shown here, and it has a steep decline. So that we call it as a rapid wash-in and a rapid washout. So once we do a dynamic contrast and we get these graphs, it is an extremely accurate technique to say whether a lesion is benign or malignant. Let us come to another smart tool, that is high resolution. So this is a 2 millimeter thin axial T2 image of the prostate. So now the prostate has an anatomical division of a central zone which is shown in blue and a peripheral zone which is shown in red. Malignancy almost always occurs in the peripheral zone. So this is seen as a dark area here which is shown by the red arrow, and this is now restricting diffusion. We have done a diffusion for this. So you can see that in the DWI it is bright and on the ADC it is dark. So it is restricting diffusion, and that is very pathognomic for a CA prostate.